Okay, good afternoon, good evening, everyone. I'm Dr. Fabian Sandoval. Welcome to this event that we are conducting today on what do you know, COVID. But it's a little bit interesting, the reason why we're going to talk about COVID today. There's a lot of stuff happening in the news that we all need to make sure we clear the air so that we all know where we stand regarding our children being vaccinated, medications being given for COVID between Pfizer and Merck, the different types of vaccines, age-based, which ones work better, which ones you should and shouldn't use. All these concerns is the whole point of this conversation this evening. This is also being recorded, so it'll be nice because you'll be able to have access to this information later. And this information changes almost on a daily basis. So something that I might say today, which is November 16, may not apply tomorrow or the following week. So it's important that if you're watching this as a pre-recorded session, you keep that in mind that today, as of November 16th, this is the most up-to-date information that we have available and what I can share with you as to what's happening with COVID. Part of this is also important for our community, our Spanish-speaking members as well, because this is affecting all of us. Black and brown patients are being affected tremendously. I am a Hispanic person, and I say that I'm not just a physician, I'm a person first of all, and we all have the same concerns that you all do. So the only difference is that we have a little bit more access to information that we want to be able to share with you so that you know that the information that you're receiving is accurate and important, that will affect us. One of my biggest concerns is individuals grabbing information from the internet that doesn't have a lot of validity. And part of it has to do with home remedies as well that really absolutely do not work on the management of COVID. There's some symptoms that we can manage, right? Some of the fevers, yes, home remedies are important. And then the simple home remedy for a fever is a cold cloth, right? But a lot of individuals are using a lot of things that are just cooking materials, right? A lot of individuals think garlic is the cure-all. Others think lemon is the cure-all. And it's not true when it comes to this. This is a virus that it's being attacked, that's attacking our body very differently. So let's talk a little bit about what happens. We all know that COVID enters our system through our mucous membranes, which is why we always have to wear masks. Even though I'm vaccinated and I feel comfortable, I will still wear a mask when I'm outside. And that is because there might be a different strain that's out there from someone who is not vaccinated. And that is the concern right now. It's for those individuals not vaccinated that they may have COVID-19 and be what's referred to as a silent carrier. A silent carrier is someone who is otherwise a healthy individual who has kept themselves well nourished, good exercise, does not have any comorbidities, right? Meaning comorbidities, meaning obesity, high blood pressure, sugar, high levels of sugar, problems with asthma, but asthma is it's a different type of a comorbidity. But these things affect an individual. And if you don't have any of these and you happen to catch the COVID virus, you are now walking around, but you feel fine, but you're able to infect others. And when you infect others, you breathe the air, you exhale, and you give off these little particles. And now someone who may be a little bit more vulnerable than you will catch it. And when those more vulnerable individuals are probably your grandparents, your parents, your children, they will get it, and then they will be sick, and you won't know why they got sick, realizing it's the silent carrier that was the one that contaminated the whole household. And that whole household was probably not vaccinated. So because of that, those silent carriers, it's important for you to know that there is a current treatment out there. There is a clinical research study that's being conducted right now from Merck. And I bring this up because there's no point of disguising any of these pharmaceutical companies as to what they're doing. So Merck has a new antiviral medication, which you can take. First, it started off as treatment for someone who was COVID positive before the vaccine came out. So it's an antiviral and it keeps the virus from replicating. And it worked very well in the clinical research studies and the results that came out. It works so well that now the next stage is that now they're implementing that same medication as a prophylaxis. So if you happen to live with someone who is COVID positive and you yourself have not been vaccinated, then this medication might be something that you would probably be able to take if you're lucky enough to find a site that has the medication that is still under research studies and research approvals. So it's available, but it's part of research protocols that you can find it. And that same medication, very similar activity is what Pfizer is coming out with. And Pfizer is now looking to use it as an emergency use authorization, right? What is an emergency use authorization? It says that in a situation like we are right now in this global pandemic, which is kind of an oxymoron because a pandemic is just that, it's for everywhere, is this pandemic that is causing so much havoc that the FDA and many times will give, if we can demonstrate proof that up to now and into the research studies, all the results have been positive, then these individuals are able to receive this medication through an emergency use. Doesn't mean it's fully approved. That takes a little bit more time because we will still continue to gather information. Then it becomes available and the FDA approves it, gives us its stamp of approval, and now it's on the market and anyone can either prescribe the medication or in the case of the vaccine, for Pfizer's case, you're able to actually go anywhere and get the vaccination, which before we really couldn't. It was a little harder. Remember, we're going in phases of people who could get vaccinated. So that's what happens with current treatments that you need to be aware of. So talk to individuals that may have access to this. You can give us a call. Our number, that's the whole point, is for you to learn from us, is 202-239-0777. That is one of our offices where we can actually give you some information on current treatments. And like I said, this antiviral medication seems to be working very well for individuals. So let me kind of go through some of these questions that I know have come up in the past. Why am I having two, oh, not that one. So why are children getting vaccinated twice, right? And should children get the second dose? Yes, the dosing for children is important. You will receive your first vaccine and then scheduled within that time period by the pediatrician or the community clinic. The child will come back within the month to get its second vaccine, right? So it depends. And some vaccines, just so you know, is 1 month, some are 2 months, 3 months. Hepatitis, for example, is 6 months later, you get the other vaccines. But we'll follow the guidelines for getting vaccinated for your children. And now we're able to do so because we have seen evidence that the current studies were positive in preventing children from getting infection and having a high antibody count. So they are very well protected. And something else to keep in mind is, why don't they get the same dose that we get? So the reason is because we are based, vaccines has to do with our body's age. As we progress in age, our immune system also is a little bit different. So a child's immune system works a little bit different. Thus, we're able to give half the dose for the child. It has got nothing to do with weight. It's based on the immune system's response process. Can the COVID vaccine affect, it says, can COVID vaccines affect periods? No, it cannot. And the reason why it does not is because it's working a completely different system, right? The vaccine is working on your immune system versus your reproductive system. The same point, I think it's a great point, actually, not to bring up, since we're talking about reproductive system, is the vaccine will not affect someone's reproductive system. So men won't become infertile or have infertility issues, and neither will women. So because once again, it's two different systems. One is the immune system, and the other one is the reproductive system. So please don't think that that's going to cause any issue. And then if I look at some of these other questions that have come in the past, I'm going to look at this question. Is the COVID vaccine safe for children? Like I said, so far the evidence has not indicated that there's any serious side effects for children receiving the vaccine. It says, will children have a COVID vaccine? Oh, will children need a COVID vaccine to travel into the US? Probably they will. If right now on the border, they're asking for documentation of proof of vaccinations, you'll probably need it also. Now, the interesting question, which I don't know the answer to, is will there be a difference? Does it have to be Moderna, Johnson & Johnson, or Pfizer to enter the US? That is probably a better question, because if you're coming into the US with another one, I believe the answer is going to be yes, as long as they have some type of immune reaction or immune response. If the country of origin does not have one of these three vaccines, then I believe that's going to be allowable. Another question that's not written on here, but is important to ask also, is will the COVID vaccine be required from now on, like a yearly thing, like it is the flu? I believe it might end up becoming the case, because this is a continued vaccine, continued virus, because unfortunately not everyone has decided to get vaccinated. There's some conditions that have been able to get eradicated because everyone in the world had access to the vaccines and was engaged in the vaccination process. In this day and age, not everyone is so enthusiastic to get vaccinated, and as a result, we will probably never get rid of this virus. And thus we will end up having to get vaccinated probably every year, just like we do with the flu. And why we have to get vaccinated on a yearly basis? Because this virus is going to continue to change. It's going to continue to mutate, or as they say, it's going to have a different strain, right? So because of that, I think we might be seeing this for a longer period of time. Let me see some of the other questions. Let's see, scheduled boosters and COVID vaccines, doable in some parts of the US. Boosters are important. Boosters are important right now, as of this date, for those individuals who are at higher risk of the virus, people who are in contact with individuals who are sick, the elderly, people with some immune compromised systems. Yes, those individuals definitely need the boosters. And then as we move along, others will probably require it as well. Let me see, after authorizing boosters, shots, will all vaccines, Moderna boosters, receive the most searches? That's not I'm sorry, I can't answer that question. I don't understand it. Oh, here's a good one. It says, is it better to mix and match vaccines? No. If you're able to receive the same vaccine, I would encourage you to stick with the same vaccine. It's not bad. It's not recommended, especially if we're working with Pfizer and Moderna, because both of these have the same RNA mechanism of action, right? They're working with the mRNAs to make these proteins that are going to protect us, versus the Johnson & Johnson one, or Janssen, which is the traditional vaccine that's making antigens directly. So if we're talking about actually getting vaccinated, we also have to remember what happens when you're getting vaccinated and your child is getting vaccinated. Now that we're receiving Pfizer, please make sure that when the child or yourselves or some of your friends get vaccinated, do not rub your arm afterwards. This hard friction on your arm can actually break apart the vaccine proteins that are being injected, so that your system can start making additional proteins, because it's very, very delicate, the mRNA that's being injected. So we don't want to do this type of a movement. Once you get vaccinated, you can hold your hand, you can do a little pressure in here, just for the pain's sake. You could put a little light compress on it, but only later do I recommend that you go ahead and rub your arm. Keep your arm soft, hence, which is when they prepare the vaccine, they do it very gently because they don't want to disrupt the mRNA that's in the vaccine. Let me go back to the top, some additional questions. Okay, some of the questions are very similar. We're still just talking about children and COVID. When will younger kids be able to receive the COVID vaccine? Right now, what is the younger kids? I know we have approval for 5 to 11-year-olds as the last one. Those babies will probably get approved once we have the next batch of clinical research results from those babies to see if we are in a safe point. And what we're going to do is then we will establish a safe dosing regimen for the babies. And at that point, we'll be able to give them the exact same way that we're able to vaccinate against the flu right now is how we're going to be able to vaccinate for COVID. It's another antibodies that we'll be giving. It's just going to be another shot that we will administer. So speaking of babies, let's go back a little bit further. Pregnancy. So if we talk about moms and their babies, we are going to see that if a mother is vaccinated against COVID-19, the baby will also be born with the antibodies for it. Now, what we don't know, because the research is not out yet, is for how long will that baby have immunity? That's a very important question that we need to keep our ears out for when those results come out. We are doing a study right now, but it's for another virus. It's respiratory syncytial virus that normally it's administered to children after they're born, but we are actually administering the vaccine to the moms so that the baby is already born with those antibodies. And the reason why that's important is RSV, respiratory syncytial virus, COVID, H influenza, all three look very similar. They look similar in the symptoms, the body aches, the headaches, the fever, and those symptoms can drive a child to the hospital. If you have a child that has RSV, respiratory syncytial virus, it's one of the most contagious viruses in kids, and probably one of the primary reasons babies end up in the emergency room. You may not have heard of it, but it's been around for a long time. There hasn't been a vaccine until now for us to give to the mom so that the baby is born with the antibodies, which is a fantastic way of protecting the baby, because now you know that your child, if he or she is sick, or you should say this baby, that it is not RSV, and that it could be the flu or it could be COVID. But if you don't vaccinate them against this, or like when it's going to happen with the moms who are now also giving their babies antibodies for COVID-19, you don't have to worry about saying, oh my gosh, my baby is going to have to go to the hospital. Does he have COVID? Does he have RSV? Probably not if you've been vaccinated yourself as a mommy. So that's great that nature is so beautiful and it's able to transmit those antibodies from mom to baby. So if we continue talking about this new change in the vaccination process, it's important for us to really understand why it has to happen. And the why for the moms is because they're going to protect themselves. We don't want the moms to have any issues during the gestation of the baby, and we don't want moms to have any issues once they deliver, and we don't want the babies to have these issues as well. So this is a very nice way, very modern way for us to protect them both, mom and baby.
And so if I may, there are two questions, one from Facebook that's related to what you're sharing now. And then there's another that's you maybe iterated a little bit earlier, but if you wouldn't mind going back to the first is, can children actually get long COVID? Meaning similarly to what we hear about adults in terms of
Sure.
the after effects of COVID, if you wouldn't mind responding to that question.
Yes, absolutely. Babies can get long COVID if they don't have the protection, right? If the babies develop the virus, if they contract the virus, then we may see some after effects, after lingering side effects of the baby. What are those effects? Remember, what does COVID do? COVID does two things. It restricts our ability to breathe. And because of that, it's the inflammation of vessels. So when we have inflammation of vessels, we have decreased blood flow as well, which is why we have issues in our extremities. We can have some inflammation. We have the inflammation in our lungs because it's at the very ends of the smallest vessels, blood vessels, that get inflamed. That's why we have cardiac problems, right? We have inflammation of the walls around the heart that can happen. And we can have issues with our memory because, once again, there's inflammation. There can be decreased oxygen production, or not production, delivery to these organs, because since our lungs are also inflamed, they don't have the ability to exchange that carbon dioxide and oxygen and take a lot of oxygen to these organs. So there can be an issue with the development of the brain. There can be some issues with development of any organ, right? Eyes need those little teeny tiny blood vessels, those capillaries. The heart needs those capillaries. Our kidneys need those capillaries. That exchange can have tremendous impact if there's not enough oxygen, especially during the child's development. So absolutely, there can be some longer issues with long COVID in children. What was the other question?
And so the other question, a person wanted to know, a YouTube follower, they said they got 2 shots of Moderna. Should the 3rd dose also be Moderna, or is it better to get the Pfizer?
No, that's a great question. If you have the option, I would recommend that you stick to the same brand, because even though the technology is almost identical, it's better to receive, if you can, the same Moderna vaccine. If there's no other option, then plan B would be to receive the Pfizer one. Otherwise, stick to Moderna. Those are the questions then, Simone?
Yes, thank you so much.
Sure. Okay, so we are just up 30 minutes into our chat. As we continue to chat, it's also important to say, so what's going to happen with the masks, right? Are the masks really good for us? We know that they are. We know that we're going to have to wear them, and we know that we're going to have to wear them for a little bit longer. It's to protect others, like I said. And yes, do I see a light at the end of the tunnel? Eventually, I do. I personally don't think it's going to be within the next year. I think we have at least another year or year and a half of these masks. If you would have asked me at the beginning of the pandemic, I would have said, and I did say 1 year is all it takes, because I was optimistic of our fellow humans around the country, that everyone was going to want to get vaccinated. I was envisioning more drones of people. We did have a lot of people getting vaccinated when there seemed to be scarce. It was almost like when COVID first came out, that everyone was rushing for paper, toilet paper and water, because that was like the hot commodity. Now there's so much toilet paper and water, people don't care. I'm seeing the same thing with the vaccine. At first, there wasn't enough vaccine. People were desperately trying to get the vaccine. Now that it's available, no one wants it. And it's disheartening, because that's why we are still continuing to wear masks. I'm a strong believer in science. I'm a strong believer in religion as well. You know, I'm Catholic, and I bring religion up because some individuals that don't want to get vaccinated say that they hope the Lord will protect them. I also believe in the Lord, but I also think that the Lord gave us the ability to become scientific thinkers and help develop this vaccine so that we can protect our brethren, so we can protect our neighbors, and we can protect ourselves, and then continue to preach the good word of the Lord. But that doesn't happen if we don't get vaccinated. So, and that's what's going to happen. We're, you know, that's just one of the many reasons why people don't get vaccinated. Let's talk about, let's get a little controversial here. People weren't wanting to get vaccinated because they said that there was fetal cells in the vaccines. Well, the fetal blood, the fetal cell line that was in this development did not take place within the development of the vaccine in itself. Some fetal cell lines are used in a variety of research trials, but they may not be current fetal cells. They're cells that have been progressing throughout the years, and it's a standard cell line that's used very commonly in lots of research. And another one that was used that you might have heard of was the HeLa cells, right? HeLa cells are used in the lab quite a bit, and that's just a different type of controversy because it was the Henrietta Lacks story that had to do with using these cancer cells that were so strong and lived so well when it came to do other types of work. But that's a whole different topic. But my point is, we don't have the issues of fetal cell lines in these current vaccines. I think we would be able to move. And as a matter of fact, if we're going to get a little bit religious on here, the Vatican approved of getting vaccinated. So it's great that we have support from different levels, truly different levels from above, saying that we should get vaccinated because we're protecting everyone. So now we've talked a little bit about that. Let's talk a little bit about the current treatments. If you do happen to be COVID positive, what are you going to do? You're going to stay home. You're going to isolate. You're going to keep everything as clean as you can. You're going to blow your nose and take that tissue and throw it into the toilet right away. Don't keep it around the house. Don't keep it in that trash can. Keep the areas as sterile as possible. There's plenty of wipes now that you can use. The alcohol gels still work, the Purells, and soap and water still works fantastically. Monitor your symptoms. Get a pulse ox. Have that little device that you can buy those everywhere that's going to tell you your saturation rates. A little device you put on your finger and it starts to beep, and it starts, basically what it's doing, it's seeing how saturated your blood is. And the blood saturation means how much oxygen is in your blood at that time. If we should have, on average right now, me speaking to you, I should have a blood saturation between 92 or 93 up to 100. If I hyperventilate, I can get to 100%. But for the most part, people's percentage is about 95, between 93 and 98%. If your your concentration goes down, we're watching him. If it gets to 85%, you should be in the hospital. You should not stay home and see that you're going to get better on your own. So it's a very easy number to remember, just 85. If it's below 85, it's important that you get medical attention right away. And what are they going to do for medical attention? The first thing they're going to do is try to drop your fever and then help you get better oxygen saturation. So they're going to put you on oxygen so you have more oxygen to breathe as opposed to just breathing room air. They're going to probably put you on your chest or a supine so you're down so that you can breathe better, because the weight is a little bit different and you're able to breathe a little bit better. They're not going to recline you all the way because I'm going to keep you up to help you breathe a little bit more. Those are the things, just plain care that you're going to start receiving. And then as we see other symptoms, those other symptoms will be managed. All those symptoms can be managed properly now. There was just a lot of concern about staffing just being exhausted and getting staff burnt out. So now that we have that, I want to remind you, between right now, the last statistics I heard was that 90% of the individuals that were being hospitalized for COVID were individuals who were not vaccinated. So only 10% of the population who was vaccinated was getting another COVID infection and hospitalized. But those individuals probably have those comorbidities I mentioned to you, being overweight, diabetic, hypertensive, and asthmatics are at risk. And then people with immune compromised disease, HIV, cancer, those patients would probably also have it. So 90%, it teaches us very simply, if you are vaccinated, the likelihood of you being hospitalized is less than 10%. If you're not vaccinated and you get COVID, you have a 90% chance that you're going to end up hospitalized, or those patients hospitalized are because they never received the vaccine. So That also has to do with our financial status. So, it's very expensive to be hospitalized, especially if you don't have insurance. And if you don't have insurance and you get hospitalized, you're not able to take care of your family. So think about that as well. That it's not just affecting you, but it's affecting everyone around your nucleus, which is the reality. And it's not hard to recover, and you will get some of this long haul symptoms that has been mentioned earlier today. How are we doing, Simona? All right.
Doing good, thank you.
Okay, good. Let's see, I have some other information here I can share with you. Mhm.
I have a question by text, Dr. Fabian.
I see.
Do you have any general tips for families about staying safe over the holidays with family gatherings and stuff?
Um, so those tips have come up before, and right now, the truth is, if you're vaccinated and everyone in the house is vaccinated, enjoy the holidays. If you're going to travel, make sure that you are protected before you arrive. If individuals are not vaccinated, you run a risk of having a sad holiday season because you can probably infect others. Otherwise, I think it's okay for families to start getting together. Now we've missed almost 2 holiday seasons where we haven't been able to share it with others. There is no reason why you shouldn't, if you've taken all the precautions, if you've been vaccinated, to do so. That's one of the other positive reasons to get vaccinated, and why there's a new push for families and children to get vaccinated so that they can, because the holidays are coming. And not just that, it's getting cold. And what happens when we get cold? We are in smaller groups. We're more indoors. And when we're indoors, we are increasing those risks of being infected. During the summers, a lot of people were outside, and I was encouraging them to stay outside, have picnics with families outside, so that you're not in these closed environments with poor circulation as well. The poor circulation happens just because we're in a tight group, so we can't run that risk. And speaking of tight knit groups, we see that in some lower income families that live 5-6 people in a 1 bedroom or 2 bedroom apartment, which is a very confined space. And those confined spaces are perfect for the spread of not just COVID-19, but any other airborne disease, airborne infection, like tuberculosis, believe it or not, or we might see, or the flu, which is the common one, right? And of course, COVID. But in those closed environments, we have to be very, very, very careful. So as now families are getting together in these closed quarters, it can be very problematic for those families, and not realize where they got it until they start kind of counting off that it's more and more associated with one particular event. Otherwise, enjoy your times if you're all vaccinated.
Thank you.
Okay, we have about another 10 minutes to go. And we just switched. Wow, it got really big. Okay. So let's keep talking now on the next part. What's going to happen once we're vaccinated? And not just once we're vaccinated, once we're trying to come back to normal states of life. I think it's not going to be easy, because we're going to be very mindful. And speaking of not being very easy, let's talk some more about children. We need to keep talking to our kids about what's happening with COVID. Let them know the pluses and minuses when they're doing something right. We need to set the example. We need to be good parents, good grandparents, and show them the right way of doing things. I've seen it in several areas where children are having issues, social coping issues, and some individuals developing a little PTSD because of COVID. Social interactions have really changed the dynamic of our children. So we can't let them lose this. We can't let them lose the ability to interact with others in a loving way. But they can't do this unless they and everyone at home is vaccinated. then they can go back and hug. Then they can go back and touch their friends and shake hands and give their little friends hugs. That human touch is so important for our healthy state of mind. But that healthy state of mind for if it's hard for us as adults, it's very hard for children, and they don't know. And I've seen it. I've seen children that might want to have wanted to go up to someone and hug, and they take a step back and they get very fearful or are overly precautious of using their masks. But I would rather see a child wear their mask than not wear it because of the bad examples set by those in the household when the child should be wearing one to protect themselves. Once again, if they're at home with loved ones and they know they're fine, by all means, no need for it. But I think we need to help our children as well adjust and readjust as things start to change again, because we're going to see a lot of um, mental health issues later on if we as healthcare providers, we as parents, we as good humans, if we don't take the time to talk to our children about what's happening and give them the right tools for healthy living, not the time to kind of tell them the some of the things that we might think is correct unless we ourselves are well educated on it. And it's very simple. The vaccine helps. It helps everyone. It helps grandma. It helps grandpa, right, that are around. It's helping protect them. So we get vaccinated to protect ourselves and protect those around us. It's very simple, but it's a message that we have to continue to use. I think the only one of the positive things about COVID is that I think people are washing their hands more, and right, washing their hands more. We are being more diligent about communicable diseases, which is very important because otherwise, as the world grows, we're going to have a lot more disease if we're not careful. And speaking of disease and being careful, I know this has nothing to do with the virus, but antibiotics can also become a very big problem. Not that they exist, but that when you take them inaccurately, right? These are viruses. They don't respond to antibiotics. Antibiotics are for bacterial infections. And if you happen to ever develop a bacterial infection and you receive a dose that's normally for 7 days, a few are very short, maybe 3 days, and there's even one like a 1-day pill. But most antibiotics are at least 7 days, 2 or 3 times a day. Please make sure you take your medications as indicated, because if you only take it for half the time and you just leave the other half for later, what you're doing is that you're developing a resistance, and that resistance can cause worse effects later. So I know this is a bacterial thing, but it's important because we're showing good habits for proper healthcare management of ourselves and giving that example to our children. We have.
And so there's a question that's somewhat related to what you just shared in terms of like protective measures that came in through YouTube. One of our followers is asking the question, why has most of the public dropped to talk about eye protection so much? If you would mind speaking to that. And if you've also, this is a 2-part coming in through text, but related. There's also been talk about nasal sprays being a protective measure for COVID. So if you can also speak to that, that would be amazing.
Okay, well, let's talk about the nasal sprays first. No, let's do it in order because it deserves the right order. So the protective eyewear is also important because the virus enters our body through mucous membranes, right? Most ones are up top, your eyes, your nose, your mouth. And yes, eyewear should still be used in a lot of cases, but probably if you are wearing a mask and you're wearing it properly, you're not going to have anything escape to get out if the individual is positive to get out and infect someone's eyes. But yes, the eyewear is important as well. Some of those face shields, the face shields work as long as you're wearing also a mask. The face shield alone without a mask is nice because it's keeping a little bit of that barrier if you happen to be sick to spreading it just a little bit, but it's not capturing. And if there's someone around you and you're wearing the face mask and you are safe, you're definitely going to still breathe that contaminated viral particle air in through your nasal passages. So it doesn't work for that, but it's important to use it because it's going to protect your eyes. In that case, it's good. Regarding the nasal spray to protect against it, there isn't any nasal spray that we can use right now that's going to eliminate a virus that way. The only nasal sprays that are available are for the vaccine, for the flu vaccine. It's called flu mist, and that is used in children. We can use that process to deliver an immune response. And that's also one that are used, actually, some medications are used that way. But no, a nasal spray, at least to my knowledge right now, I haven't seen a nasal spray that's used to prevent COVID or to administer as a vaccine. But that's a good question. Okay, so I'm gonna give you just my 5 minutes as we end our hour. And it's now just to talk about good habits. I think our good nutritional habits are very important to keep healthy. And part of the reason why we need to keep healthy is because if we stay healthy, we are able to help our immune system stay stronger and fight off some of the viruses. Eating healthy is very important. Why is eating healthy so important? Eating healthy is going to reduce our levels of cholesterol. Cholesterol in our body causes inflammation. And the whole talk today, this evening, has been talking about the fact that COVID causes inflammation. So if you have high levels of cholesterol, that's going to cause some inflammation in your system. So, and if you happen to be infected, that inflammation is going to double. And as that doubles, then you're going to have more serious complications. People with high blood pressure have high blood pressure not just because of stress, but also because of high cholesterol levels. It makes it harder for the heart to pump blood throughout the body because there's a lot more resistance because of plaque buildup, and that plaque buildup can have to do with the cholesterol levels in our body. And triglycerides can go up, and this is going to cause a lot more effort. So if we are able to do a little bit of exercise, and I know it's harped on all the time by anyone that wears scrubs or works in a clinical setting, healthy eating and exercise, diet and exercise, diet and exercise. So it's true in this case as well. If we exercise well, once or twice a week, do some type of aerobic activity, and reduce our intake of high fats, we're going to increase our ability for us to stay healthier. And that healthy body is going to help us with the addition of the vaccine. Having both of these, we will be able to fight off the virus and not notice it. I'm sure I've been around people who have been COVID positive, but I try to stay healthy, and I've been vaccinated, so I haven't gotten sick, knock on wood, thank God. But that it's important. Good nutrition and exercise. Here's my tip on good nutrition. Half of your plate needs to be a vegetable. Salad. Always throw half of your plate can be salad. And then, so half is the salad. The 1/4 that's left is going to be your protein, fish, chicken, meat. Make sure that the chicken's has no skin on it. I know it's the most delicious part, but it's what's the worst for you. Lean beef, like I said, is important, and chicken breast. And then the other part can be your starch, your rice, your pasta, bread. And that way, that is a great guide to just help you eat a little bit better. Cut down on the carbs, cut down on the pasta, the rice, the tortillas. Those things are going to cause us to gain more weight, and that's what we're trying to avoid. Keep the weight down, and if we keep the weight down, we're going to stay healthier. Our cholesterol levels are going to stay down, and with the combination of healthy eating and vaccinations, we are on the right path to staying healthy, staying alive, and not have to worry about this COVID vaccine that's really affecting us all. So I hope you've learned from us today. Once again, if you have a specific question on the COVID treatment, if someone is positive in your house and you have not been vaccinated, please give us a call. We will direct you to the right location where you can get some of this information. For this particular treatment only, you call 202-239-0777. Again, I'm Dr. Fabian Sandoval. I am part of Emerson Community Clinic and a part of Emerson Clinical Research Institute. I hope you enjoyed this talk tonight, and thank you for giving me the space to talk a little bit about this more freely and educating you on what we're doing in the research field as well. Thank you.